Hello, my name is Kelly. I'm a teacher. I teach 5th grade for the last 23 years, and I have a 16-year-old son. Probably for the last 10 years, I've been very focused in taking care of my son and neglected my own dental hygiene. Very embarrassed to say that, but it's true. And although I flossed and brushed my teeth regularly, I didn't see a dentist like I should have regularly. I kind of bounced around from different dentist to dentist, and so having a little gap between my back 2 teeth, I always got a lot of food stuck in there, and I was always poking at it with toothpicks and tooth floss, and one day I think I poked a little too hard, but I poked my gum and it got infected, and there was probably already an infection in there, but I wasn't sure about it. And until I grew a little abscess on my gum. So I went to my dentist assigned to me by Broward Schools, and they said they took an x-ray and immediately noticed that half the jawbone underneath the tooth was gone. And they were ready to take it out that day. But as you can imagine, my shock and horror of the fact of losing a tooth, I was also very afraid. Probably one of the reasons why I never went to a dentist for a long time. And then I got some second opinions from a periodontist to see if they could help me with the gum, and they agreed that that was not an option. I got Dr. Sclar's phone number from a family member, and I called them right away. I was impressed at how professional everyone was that I talked to on the phone, down to Dina, the first person I talked to, who immediately made me feel so much better, answered all my questions, and set me up with an appointment right away. My first opinion walking into the Sclar Center is that it was so clean, and everybody was so nice, and it was the most beautiful office I had been to. The second thing I was really impressed about was the updated technology that this office had. It was no longer the x-ray of the past, which probably kept me out of the dentist's office, where you sit there and you're very uncomfortable with things in your mouth and they're cracking your neck all different kinds of ways. But I just very comfortably sat down in a nice chair, and the x-ray machine went around my head a couple times, and step 1, that was pretty easy and painless. Then when I sat down with Dr. Sclar to review my records and to review the x-rays, I was amazed at the technology and how much you can see every little detail of what was inside of my mouth. And I didn't need any convincing whether I needed this done. I knew I needed it done at that point. So being very upset, I must say I cried for a couple days knowing I was having to lose a tooth, but it wasn't an arm, it wasn't a finger, it was just a tooth. And with the technology these days, something that could be replaced. And I felt it was important to do everything I could to save the rest of the teeth in my mouth that I had neglected. So the day of my surgery, I came in, and again, the office staff just reassured me that I was going to be just fine, and it was going to be over before I knew it, and I wasn't going to have any pain. And they said it with a lot of confidence, and of course, you still have in the back of your mind, yeah, okay, I'm losing a tooth. I mean, I'm sure there's some pain involved. So I sat down, and I was in such a comfortable atmosphere with a nice warm blanket, and they had a nice TV screen, and they offered to put whatever music I wanted, and I asked to see a picture, the video that my son had made of him surfing, because I knew it would put me in a very relaxed feeling. And, the worst, I can't even say pain, but I felt one little pinch on my arm. I was kind of in a sleep, I think, but I'm not really sure. It was kind of hard to tell. I woke up, and they were preparing like some type of oral Band-Aid over where they had extracted the tooth. And come to find out later that it was a lot. It was a big job. It wasn't just a simple, just take out my tooth. I had a lot of infection, so not only did they clean out the infection, but they grafted bone into my jaw. I mean, Dr. Sclar even used a technique that he was able to extract some marrow from my blood and put it back there while he was doing his surgery. And then again, I woke up in a little fog, and the girls were putting a little Band-Aid over it. It was like kind of like silly putty just to cover it up, which I'm kind of glad because I didn't actually get to see the hole, and I just kind of looked like a tooth. So I took some antibiotics and some anti-inflammatories, but I must say that I had no pain at all. I did not bleed. I did not even have to take a leave. I was so impressed. And not that I ever want to go through that again because I don't want to lose any more teeth. I just know that if I were to have to go through it again, I would not be in such a panic because I know that I had the best care. And I just feel very, very grateful. I'm back after 10 days, and my, I want to say tooth, but there's no tooth. And I'll show it to you here. It's completely healed. And the bone grafting and the bone has regenerated enough, so in about 3 or 4 months I'll be able to have an implant. It'll be looking better than my original tooth. Because it won't have a silver filling in it. But the one message I want to give to everyone is that don't be afraid of your dentist. And if you ever need any oral surgery, Dr. Sclar and the Sclar Center is the #1 place in the world, as far as I know. I just couldn't be happier and feeling very blessed to be able to tell my story to you because it was just an amazing experience overall. And no one wants to go through losing a tooth, but it was really painless as possible. And I just want to thank Dr. Sclar and all of his amazing staff, down to the people who took my appointment, to Jill, who helped me through, and Dina, who gave me the first relaxing message, to the women who greet me when I come in. And when I sat out there today, I met a young man who was a senior in high school. He was an autistic child with his mom, and I can tell that, being a teacher, that he had a lot of anxiety about being here. But after talking to them and assuring them that they were in the best hands possible, I know that he felt a lot more relaxed, and the mom too. And I meant it. The words can't express how much gratitude I have and how good I feel too. It's waking me up to know that, your dental hygiene is important. And not only that, like the things that you put in your body to help your immune system, so if you were to get an infection again, you wouldn't end up losing a tooth like I did. So from this point on, I plan to 100% take care of my teeth and follow all my dentist and Dr. Sclar's directions. And I hope next time I'll get to come back and do this again so you can see my implant. And thank you.